All right, so this week's training, we're going to go over the first aid part. So last week we talked about CPR, this week we'll talk about first aid. Again, this is just a refresher course. This is not what will get you certified in first aid. This is just a refresher of what they go over in first aid. So before we get into it, get certified. Again, it is not technically required to be an updated teacher. There are some daycares that do require it for the subs that go into their daycares. That is listed in their requirements before you apply for a job, so you don't have to worry about that. You are able to see it. But again, not technically required, but very highly recommended. I would recommend it for all teachers just because when the worst case scenario does happen, acting promptly and swiftly really can save lives in these situations. So getting into CPR, there's three things that we will talk about, three reasons behind first aid, sorry, not CPR. The first one that we will talk about, the first goal of first aid, is to preserve a life. So again, our first aim is to preserve life by carrying out emergency first aid procedures. So this can be if somebody breaks their arm, if they fall off a slide, if they somehow get burned, just different things. Emergency procedures can help to preserve their life so that they are not, worst case scenario does not happen. Preserving life should always be the aim, but that includes your own life. So don't be putting yourself or others in danger. Good example of this, always if you get on an airplane and the airplane before it takes off, they always tell you, that you have to put on your life vest first or your oxygen first, whatever it is, you need to make sure that you're taking care of yourself first before you help other people. You are not going to be any good to anyone else if you yourself are injured or if you pass out from lack of oxygen in the airplane situation. So again, make sure that while you are helping others, you also need to be safe as well. So just to make sure that you're doing that. The second one is preventative measures, so preventing deterioration or keep it from getting worse. So this is the second aim. You want to make sure that the individual's condition isn't worsening while you're waiting for emergency personnel to arrive. So for example, if a person has a broken limb, you're going to ask them to stay still and place padding around the injury because moving around can cause further damage and further pain. Same thing if they are a burn victim, you're going to make sure that you're applying burn treatment to make sure that you are protecting those so that they are okay and it doesn't worsen as you're waiting again for that emergency personnel. The third aim is to promote recovery. So basically what that means is we're trying to make sure that we move quickly enough to get the recovery process started. The big thing with promoting recovery, you're wanting the injury to get better as fast as possible. And going back to that burn incident that we just talked about with preventing it from getting worse, when you start the treatment for a burn victim by cooling it down in any way you can, that also doesn't just prevent it from getting worse, it also helps it to recover faster. And as you will see later, it can also help from scarring long term. So again, you want to move quickly so that you can get it to the recovery process as soon as possible. So simple first aid can greatly affect the recovery process of an injury. If we are just calling 911 and just waiting for them to come, it can oftentimes get worse, and that will delay the recovery process. It will oftentimes increase the pain that the person is in because they're just sitting waiting. So applying first aid can, again, affect the recovery process of an injury in a positive manner. So example, again, talking a burning, cooling a burn quickly can prevent it from scarring. It can help reduce the pain that the person is currently in, and it will encourage that burn to start healing sooner rather than waiting for them to receive treatment from that emergency personnel again. But the best way to promote recovery is by arranging prompt emergency medical help, meaning call 911 as soon as possible. Because while you can help cool a burn, if there's other things that need to be done that you don't know about or you're not aware of, being able to get prompt medical personnel on site can again greatly help in ways that you cannot help these injuries. So any questions with the preventative, the promoting, and oh, that one we just talked about, preventative and the preserving. Any questions with those three things? Awesome. So what we're going to talk about next is probably the biggest thing that occurs most often, which is choking. We will talk specifically choking with infants when it comes to how to handle the choking situation, but then we'll also talk about signs, what signs are signs of choking, and also what are signs that a person is not choking and they're able to handle the situation by themselves. So first we will talk about the signs that a person is actually truly choking. So the first one is an inability to cry or make much sound. If they look like they're having a hard time breathing, but they aren't crying with it, if they look kind of concerned, but they're not making much sound with it, that can be a sign that somebody is choking. Remember that a person who is choking cannot verbally tell you they are choking. If they can verbally tell you that they are choking, they are probably not actually choking because air is getting through their windpipe. So again, a good sign a person is choking is when they can no longer cry or make any sound. Another one is weak and ineffective coughing. So typically when a person coughs, it's trying to accomplish something, whether that's clearing your throat, it's you've got a hair there that's tickling and you're trying to cough to get the hair away from your throat. Coughing typically has a purpose behind it. And in this case, it is the same thing. If a person is coughing while they're choking, typically it's not going to be effective though if they are truly choking because they're not getting enough air behind it to be able to push that piece of food or whatever it is that they're choking on out of the way. So while there might be small, tiny coughs, it's not going to sound effective and it's not going to sound very aggressive either. So again, while the sounds might be happening, it isn't doing anything to help remove the object, so we need to be stepping in. Another sign that a person is choking is having difficulty breathing. In infants and young children, this typically means that the ribs and chest are retracting. But specifically in infants, dramatic movements of the ribs. So it's basically like they're trying to breathe, but when it's more dramatic than just a normal person taking in a breath, it's a pretty good indication that they aren't getting enough air. They're trying really hard, so their chest is working really hard, their lungs are working really hard, but nothing is actually entering the lungs. That is a good sign that a person is having a hard time breathing. And then these last two kind of go together. The bluish skin color is your first indications that a child is not receiving enough oxygen. And it's the start of them actually passing out. And then another sign, again, is a loss of consciousness if blockage is not actually clear. So passing out from lack of oxygen is a pretty good sign that a child is choking. Again, situationally, there are some kids that when they get mad or upset, they will intentionally hold their breath to try to get you to give them an answer that they like. So if they pass out from holding their breath, that obviously is not a sign of choking. But if there's unexplained loss of consciousness, typically could be a good sign that a child is choking. We're going to now talk about things that are not signs, which kind of, some of them are on the, some of them, their base is on both lists, but we'll talk about the differences and why it's not actually a sign in these situations. So gagging. Most children, when introduced to new foods, when introduced to new experiences, if they're eating something they shouldn't, like grass or dirt, gagging is a very natural reflex for children. And oftentimes it doesn't actually even mean that they're choking or about to choke on something. It just means that their body isn't used to the taste of something, so they're gagging on it. If they are gagging, though, in a food is trying to go down their windpipe way, gagging is the natural reflex designed to prevent choking. So don't intervene if a child is gagging. Their body is doing what it's not supposed to do. Watch them though, because if that gagging turns into them not being able to breathe, if their body isn't able to actually move that piece of food or whatever it is again out of the way, they can start to choke. And at that point you would need to step in. But again, if they're just gagging, leave them be. Their body is doing what it's designed to do, and that's okay. Coughing. So again, this one was on the other list, but this one, it is not a sign if the coughing is loud, or it sounds effective. It sounds like they're actually being able to move things out of the airway. So give the child a little bit to try and work through the situation on their own. Again, you don't want to intervene because this is natural and normal. It is their body trying to handle it by itself. And if you do intervene, sometimes you can make the situation worse, which we will talk about in a second. So along with gagging and coughing, typically if they gag and they cough a lot, it will lead to vomiting. So this again is a normal defense to prevent the body from choking. It's to prevent food going down the airway. Good example of this, I was at a daycare and one of our 18-month-olds was eating grass, and we were trying to do our best to get it out of her mouth, but she still had a little bit in her mouth. She started gagging and coughing on that piece of grass because it was just tickling her throat. And she vomited pretty aggressively, but that piece of grass did come out with it. So again, it's natural, it's normal. It does help with the removal of food. And if they vomit in this situation, it's not an indication the child is sick. So again, very situational. If a child is coughing and gagging and then they vomit, probably not because they're sick, probably because they had something that was trying to get stuck in their throat. that was irritating them, and their body naturally was just getting rid of it. If a child is not truly choking, again, don't intervene, let their body handle it, and don't do a finger sweep. A finger sweep is when you put your finger in their mouth to try and remove food, and it's actually a part, typically in older kids, it is a part of, if they are choking, you need to apply those emergency measures. It used to be called the Heimlich maneuver. It's not called that anymore. But that chest compressions, basically, in a sense, where you're trying to get the airway from the lungs to shoot the piece of food that is causing them to choke. Typically, if in smaller children, you would turn them on their side after you've done that a couple times, and then do a finger sweep to try to get food out of their mouth. If they're not choking though, and you do a finger sweep, you could make it worse. That could cause the food that they are trying not to choke on to move towards the airway, and then they could end up choking on that food because you've pushed it in a spot that it's not supposed to be. So again, if they are handling it, if their body is handling it, if they are showing any of these signs, let their body work it out. And then if they start to choke, if their body is unable to, that is when you should step in. Any questions on signs or anything else? How to, if an infant is choking, how to help them with that. Okay, so we're going to talk, it's called chest thrusts for infants. We're going to talk about if an infant is choking, how to help remove that piece of food or whatever it is that they're choking on that is blocking their airway. So do not perform chest thrusts if the forcefully or has a strong cry. Again, these are indications, as we just talked about, that the child is not actually choking, but that their body is working it out by itself. If the coughing again is that very strong and they are unable to cry, then you should probably start moving towards the chest thrusts. So the first step, you're going to lay the infant face down along your forearm, and then you're going to use your thigh or your lap to help support your arm as you're holding this child. Again, it's going to just make it worse if you aren't supporting yourself and making sure that yourself and your arm aren't wearing out. Because if your arm does wear out and you lose grip on that child, they are falling, and that is more injury while they're still also choking. So placing the infant face down, so their stomach against your actual arm, and then using your thigh or lap for support. You're going to hold the infant's chest in your hand and then their jaw with your fingers. Obviously, I am bigger than an infant, and there is a picture at the end that I will show you that shows all of these things. But typically, you're going to use like just the 3 fingers to hold underneath their jaw so you're not choking them, but underneath their jaw so that they're still supported while you are holding them with your arm. Third, you're going to point the infant's head downward so that it is lower than the rest of their body. This will help the air to projectile that food out of their mouth, so that it's still not stuck in their mouth after you have cleared it from their airway. And then fourth, you're going to give up to 5 quick forceful blows between the infant's shoulder blades and using the heel of your free hand. So if I was holding the infant in my left hand with their chin in between my fingers and the rest of their body against my forearm, I would use my right hand, the heel of my right hand, to give those forceful blows. This is going to be done pretty hard because you want the whatever is blocking their airway to actually get out. If you do it very gentle, it's not going to help, and the child is losing oxygen as you are doing very gentle blows or taps to their back. So again, it is going to be pretty forceful. It is going to be pretty, it's going to sound like you're hurting the child, but you're not. Their back is pretty strong and it's pretty resistant. And again, they can handle a little bit of hurt on their back if you are protecting them from dying from choking. So the 5 forceful blows. This is a good picture. You can see here that they are holding the infant with their right hand. Their thumb is on the one side and then the other fingers on the other. Their stomach is against their forearm, and this looks like they are using their whole lap to rest the child on so that their arm doesn't give out and doesn't get tired. So they've placed them in that position, and now you can see that their left hand is the one that is giving those forceful blows, and you can see here it's indicating in between, pretty high up on their back, in between their shoulder blades. Any questions with these before I move on? Okay, so before we end, I wanted to ask there if anybody in participating in this Zoom, if any of you have actually come across an experience where you've had to use CPR or first aid training, and if you want to share just a little bit about that experience. There's not many of you in here, so we might not have had a person who's actually experienced this. Okay, so I do know it has happened though. In a daycare that I worked at, there was a little kid who all of a sudden started having seizures. And so the owner had to apply the first aid that she knew that goes along with seizures. My mom is a special education teacher, and she deals a lot with kids that are more prone to injuring themselves or to others when they get overwhelmed or they're asked to do something that they really just don't want to do. It is a lot more common and typical for them to, again, start throwing things, throw their body, and they can cause injury. So it is good knowledge to actually have. It is something that, again, I highly recommend you actually get certified in, because we're not immune to it. Even like in my many, many years of it, I haven't had to apply CPR or first aid. But I know that the longer I work in childcare, the higher my probability is of coming across it. Because again, we're not immune. We would like to think that we're in daycares. We've taken the preventative measures. We've cut the food small enough. But sometimes even when we're meeting regulations of how small the food should be cut, it just gets stuck in their throat in a weird way, and they all of a sudden are choking. So again, I highly recommend that everybody get CPR and first aid certified, so that we can make sure we are giving the children that we work with the best protection that we can. If there aren't any questions, we can go ahead and stop the recording and go from there.